good for transplant or chemotherapy patients?
The probiotic. Let's see what we have here. All right. Most probiotics actually are very good for most folks. However, with chemotherapy patients, people that are in chemotherapy and people that are going through transplant, this could actually be a problem. Something that does much worse than what we would think it would do. See, probiotics are great for digestion, and if you have an immune system that functions properly, you can actually balance those different types of bacteria, because all a probiotic is good bacteria in your stomach. So they live like it's like a hive, if you will, and they're big groups, and one group of bacteria kind of staves off the other group of bacteria, and they find something called homeostasis, which is basically just balance. However, with chemotherapy, you don't have an immune system, you have no other bacteria that's living in you, and you're introducing a positive bacteria, but unfortunately, positive bacteria can also cause problems when there's too many of them. It could be gas, gut bloat, and gas pains, and just overall discomfort.
So what you're telling me is that if our immune system isn't really strong enough, it can't really take enough of anything, really.
Well, it can't stave off certain bacterias, and this would be one of those types of bacteria, especially if this is the only type of bacteria introduced. See, some bacteria are considered bad, but they live in us and on us, and other bacteria are considered good, like amylase, which is, actually amylase is not, but probiotics themselves, there's also prebiotics you can chew after you have a meal that'll help kind of clean up and break down the cellular matter that you had from the meal. And those are good as well, but without that balance of what we would perceive to be like streptococcus and different types of Decoccus bacteria, which you'll find in yogurt that has live culture, they can actually cause a problem and cause problems like that, because there's nothing to stop them from overgrowing. Does that make sense?
It's kind of how cancer works. It's always in your body, and if your immune system has a weird error or glitch in it, and where it causes it to have its defense down, it can be a problem at sometimes.
Right, because nothing's there to regulate the growth, right?
Yeah.
So, what we do is an alternative to probiotics. Again, very good for most folks, and as a matter of fact, after chemotherapy and after transplant, if the doctor okays it, then this product or any other product that is a probiotic or prebiotic is an option that might help you. However, we're going to set that aside for today, and we're going to go over the pineapple.
I've heard these have good digestive enzymes that'll help cancer patients to kind of digest all the food they're taking in, so it can kind of help in
digestion itself, right?
Yeah.
Right, so the digestive enzyme in here, do you know what it is?
It is called, it starts with a B. I can't really remember.
It's a bromelain, right?
Yeah.
Bromelain, yes.
I remember that.
Yeah, see, so the pineapple itself has this great enzyme inside it, and it will actually tenderize a steak. There's some other YouTube folks that do steak cooking, gentlemen that we watch that will age steaks and dry age them and stuff like that, and he's actually taken a pretty crummy, cheap chuck roast and turned it into something amazing just by letting it soak for 15-20 minutes inside pineapple.
Yeah.
And he rinses the pineapple off, and it's tender, or even off the grill, and that's the type of meat you would stew for several hours. So this helps folks that are, unfortunately going through chemotherapy or transplant, and they want to eat proteins. This will help break that down. The bromelain will. And this is interesting. Let's go ahead and open this up so we can see some of the parts of the pineapple. We have the outside protective area, which would actually make this fruit look like something you really couldn't eat, right? It's almost like a cactus. So what we're going to do is remove the top piece here. And that gets us right to the inside. And you can really smell that. That smells good, huh?
Oh, yeah.
So the more yellow the pineapple, the longer it sits, the more the fiber inside it is going to break down and cause a little bit more sweetness and bring more sugar to to the experience of dining on a pineapple. Now, what we have here on the outside is the soft meat of the pineapple. When we get to the center of it, you're going to notice that there is kind of a very, you can push on this side because we're going to put this out and try to grow another pineapple. But see how tough that is? And then out here it's nice and tender. Look at that. It's so full of juice, huh? Sorry, I just got you there, huh?
That was a sweet concoction.
Yeah, here you are. Sorry about that. So yeah, the outside here is very tender and it's very good. And the inside here is very solid. And as a matter of fact, in that center piece, you can see here it goes all the way through to the center piece. It's at the bottom of the pineapple that was broken off from the actual bush of the pineapple. And that is the concentration of the bromelain.
Would that be connected to the roots at the bottom?
Yes, as it comes out the bottom of this, it's going to hit the plant, which looks a lot like the top of this, and it sits on top on a stalk here that goes down into the roots in the ground. And that's got the highest concentration of bromelain. As a matter of fact, you can buy bromelain pills at like a supplement store or even a vitamin shop, which would be a great supplement for this if your patient or your family member just couldn't really hold too much down, but they're able to hold something small down. Maybe they could have some crackers in one bromelain pill, and that would help with any other protein they had digested earlier that day or would like to digest later on.
But if they do want something sweet like pineapple, then
Yes.
that is a great alternative.
This is always where we start, right? Because it is a peelable fruit, although I don't know that we can peel much of this. We're going to have to cut most of this away. But when we're
Sort of
done...
like watermelon. You can't really peel it.
Right, but it still has that nice, like, outside protection from the environment that keeps the bacteria on this side and the good stuff on the inside.
Yes.
So a lot like a peach, or I'm sorry, a pear, a small pear here, also considered a peelable fruit. We can peel this away, get to the tender meat on the inside of it. Even better, a nice way to prepare this, you can take a light soap or even vinegar, and you can scrub this off nice with a vinegar. I recommend that more than anything, just to kind of kill all the bacteria that's on the outside of it. And you can put this inside a rice steamer, put the rice around, and kind of adds kind of a sweet, like, after flavor to the rice itself. But today, we're going to focus on bromelain and pineapple.
Now, how do you want to cut this?
So, first step we're going to do is remove all this outside. You can try it if you'd like, but it's not that hard. We're just going to kind of cut down like that. I'm being delicate because I don't want to cut away too much of the yummy stuff, and I also don't want to leave too much of that skin.
Oh, I almost forgot something.
Yes.
Let me go wash my hands.
You can actually use the sink right here if you'd like.
I have some soap in here I can use.
Okay, I'll continue cutting here. So we're using a glass cutting board, and prior to starting the video, the entire counter was sanitized. I used a 2-to-1 ratio, about 2 cups of water, 1 cup of white vinegar. And then of course, because we're doing a video, once that had dried up, we went across it with some Windex to kind of buff it up to make it look better. But the bottom line is, the vinegar will kill off any outstanding bacteria and outstanding possible viruses. There's lactic acid that's inside it that helps with that. You ready, Gabriel?
Yes.
All right. Any questions at this point?
Not really, but I do think that I have one.
Mm-hmm.
What do you think is the best fruit? Or, sorry,
There's a lot of those.
yeah,
Go ahead.
It's really based on your opinion.
Mm-hmm.
But
It's very subjective.
what I meant to say was, what are a lot of peelable fruits that people like get mixed up with and think that they are?
Peelable fruits that we can actually identify would be like oranges. But where people get mixed up is they'll want to take their family member who is battling this terrible thing, canned oranges, like the mandarin oranges, because they're sweet. It's a nice sweet treat. And unfortunately, because it's a mandarin orange, it's peelable. We're good there, but it's been canned. So the process of taking it from the peel, washing it, preserving, adding some preservatives, and putting it in a can, you're kind of bringing in also some interesting elements, whatever they use to preserve it with, plus anybody on that line that's doing the breakdown of the actual orange itself could be sick that day. And that's been put in a can and handed to you. You and I don't have to worry about that. We have working immune systems. But however, for your family members that are going through this stuff, it's a big worry, right? Yes. So we like to take our oranges, mandarin. If you like the cutie pies, that's about what we can get here in the States. Peel those open. You can set them up any way you want to, make smoothies with them and everything.
Yeah, and it is really great to mix peelable fruits in smoothies because they actually make a very, very nice drink.
Correct.
For cancer patients?
Absolutely. But we don't want to add any kind of yogurt that has a live culture, right? Because then we come right back into this position here. See, probiotics have a lot of the same bacteria. As a matter of fact, you can get them with a wide range, or spectrum as they call it, of different types of bacteria that are great for our tummies and our guts and for general digestion during the day, right? But yogurt is also a fancy alternative to that if that's something that you like. You can actually take 1 cup of yogurt, take some milk and bring it up to just about a boil. Let it start to cool down about maybe 5 to 6 degrees and take an actual cup of cultured yogurt, put it in there, and you would have nearly a gallon of yogurt by the next morning because the bacteria in that little cup of yogurt will propagate through the warm milk. See, the warm milk and the heat in the milk provide a medium for the bacteria to literally just proliferate and grow.
Is cultured yogurt another word for Greek yogurt?
Yes, along the lines of the Greek yogurt, yes. You're going to want to look very close at all of the yogurt you get. Pasteurized is good. That's where they take it and they literally, at a high volume, high amount of pressure, push it through like a screen. There's also another techniques that they use out there will actually boil it. And what that does, those processes actually kill off the bacteria. And that's the type of yogurt we're looking for the folks we're trying to help out. Cultured yogurt, on the other hand, that has live bacteria in it, isn't so good for our folks. But it's good afterwards. So when in the recovery process, when we're in like end of zone 3, heading into zone 4 in transplant, where it's just about where the doctors like go ahead and have some sushi, which is something we know as a big no-no. That's when you can start adding in the yogurts and the probiotics that may help revitalize missing bacteria that was killed via the chemotherapy and the whole transplant process. But in the meantime, we use digestive enzymes. And you want to talk to your doctor about this, is whether it's an actual, cut that end off for me there, son. Be very careful. You're going to want to talk to your doctor. Make sure that the enzyme approach is something that they can work with. Always. We always recommend, right, son? Talking with the doctor. You can also, whoa. You can also get a hold of medical documentation and research, and some doctors like it when the patient advocate will come to them with medical research in hand that's been tested and been proven to be like something that works and is viable and will help the patient out. A lot of times those need to be studies that have been peer reviewed, and that's what you're looking for, and you can find them all over Google and stuff like that. But for Carla, we found that giving digestive enzymes helped out a lot because she's a big steak eater, remember that? She loved her lamb, her steak, and all of her red meats. And in order to help her digest those, something just like pineapple bromelain would be good. What's even better is if you grill a good steak, you can kind of make it tropical. Remember, the patients we work with and the people that we know that have gone through this are stuck in a room up in the hospital floor. There's not much going on, and if you can bring the tropics to them and make a nice tropical steak dinner for them, I mean, that's just awesome.
Yeah.
And it helps out with digesting the whole time, right? Yeah.
It's like a one-up for everything.
Absolutely. I think everybody gets a win-win out of that. So we're going to go ahead and cut these into general rings, and you can see right here, that's the core area we're talking about. That core area has the most amount of bromelain that's inside of it. But, The downfall to it is it's very, very fibrous. So if you did want some of it, you could actually just take it and take a piece of it, something this big here, cut it in half, and rather than swallowing it, you can just chew it up and then spit out the fibrous material afterwards. Because what you're really after is that bromelain that's inside there. Mm-hmm. And that's all.
And it really just comes in with the juice as well. And it's like, I don't really know how to word this. It's just in pineapple, all of the pineapple, and the juice it contains it. So any part of the pineapple, you're getting bromelain.
Bromelain. Tomato, potato. Yeah, I think it's really just self-preference, but I think what we're doing here is a safe, viable option that patient, doctor, and family can all enjoy. The doctor's not faced with having, whoa, I'm throwing it all over the place.
Run away.
Man, put this in. Here we are. I'm going to gather the rest of that up. Over here, I'm going to cut the core out of that slice you just had.
Yes,
but working with the doctor hand in hand about stuff like this is very, very, very important. When you get down to a point where you can sit down with your doctor and have a conversation about last night's meal, and you're keeping a steady meal log, which is very, very important. Remember Carla's meal log? She would write down our lunch, her breakfast, lunch, dinner, any in-between snacks that came along, and especially if we had like some sort of a sweet treat or something like that set aside. And that's also very, very important to keep that log, especially for patients that are going through transplant, because when you come in for a transfusion or an infusion, you are going to have all of the homework that your nurses and doctors need so they can properly treat you for your visit. Without that, it's tough to determine what it may have been that gave you a stomach ache, or may have given you a rash on your skin, or what component of your diet could be affecting you during that time. Yes, that's a good one. And this is the last cut here. We're going to take that out. I'm kind of discarding the bromelain in this, but you could also take this and you could make a tea with it. You could cook it with a green tea or a regular tea and use it as a sugar substitute.
I never knew that.
Yep, and the core goes in there. The bromelain is an enzyme, so you probably wouldn't break it down too badly. You wouldn't want to boil it. You want to pour it over the tea, or the tea over the top of the slice. So you take a core slice, something similar to this, and rather than using a lemon slice inside the hot cup of tea, you just put this in there and kind of let it steep. And what steeping does is it's going to kind of pull that sweetness out of it and give your tea a good sweetness flavor. It's also going to take those enzymes out of there as well and give you the same effect. Oops, I threw that into the wrong bin. There we go. And I think at this point, that's our lesson on bromelain. So let's finish up with a sweet treat. Thank you, son.
No problem. Thank you, Chef.
Mm-hmm.
And you taught me a lot of stuff I didn't know.
Really, what's that?
I never knew you could make it into a tea. And I didn't know that pineapple actually had a classified name, and it is a digestive enzyme towards helping cancer patients.
Right, when you have someone that likes to eat a lot of steak like your sister, we got to give her something to help break that down.
Yes, and excuse me. Steak is actually good for cancer patients, but it's kind of determined how it's cooked, and it goes into more of the ketogenic diet, and it helps it a lot. We'll be talking a little bit more about that in future episodes.
That's
but you could also you could also ask us in the comments about the ketogenic diet, because we're not going to hold you back on the answers to that. Yes. We're just going to show you many alternatives